As recently as last night, former President Trump made this same terrifying promise at rallies and events across the country. He's doing that. He has promised to cut funding to schools with vaccine or mask mandates. But think about the practicality of what Donald Trump is threatening here. All 50 states have some form of vaccine mandates on the books, so Trump is essentially saying he'd be prepared to cut federal support from every single public school district in this country. Even in Trump's beloved Florida, where ultra-conservative Ron DeSantis is governor, the health department says all children who attend Florida schools, public or private, are required to be immunized. And why is this? Oh, you know, because vaccines work and have been accepted as a key component to keeping kids and families from getting sick. Joining me now, Vin Gupta, NBC News health policy analyst, and Zerlina Maxwell, host of Mornings with Zerlina on Sirius XM. Two of my favorite people. Thank you both so much for being here. Dr. Gupta, let's start with you. Just to set the record straight, why are vaccines so important?
Well, you led off with it, but measles, let's take, for example, measles and meningococcal meningitis vaccines. These are vaccines that are recommended by the CDC. In the case of measles, it's required, to your point, in school districts across the country. There's no question about it, MMR vaccine for short. Meningitis, on the other hand, for college students, college freshmen, it's recommended in most places, required in some. Why does this matter? We've noticed places like Ohio, Florida, just in 2024, have had significant outbreaks amongst unvaccinated children, which, by the way, Alicia, has resulted in 1 in 3 ending up in the hospital. 15% with meningococcal meningitis who are unvaccinated die. So we're talking about here, what are the thresholds of acceptability for death and significant disability if we don't abide by these common sense, long-held vaccine mandates for routine childhood vaccinations? We're talking about serious disability and serious risk of death.
Zerlina, what we heard from the former president, I am not accustomed to that level of message discipline from the former president. So that tells me that what he is saying is ginning up some portion of his base and actually working. This wasn't always a partisan hot button issue. How did we get here? And why is it continuing to benefit Donald Trump?
Well, we got here because of the global pandemic. And I think that there is a portion of the Republican base at this moment that is very much anti-science and anti-vaccine. And Donald Trump has proven time and again that he will say anything, regardless of the harm to people and the American public, to get an applause. I mean, you played a number of clips there, and right after he said that, there was a loud applause. And so he will say anything to pander to the extreme wing of the base that is anti-vaccine. And this is a really dangerous precedent, not just because of the reasons that Dr. Gupta laid out, but also because people need to trust their leaders to base their decisions on fact and science. And we have to get back to that. I feel like this election is so important, Alicia, because we really need to vote like our lives depend on it. And if we're not basing your decisions on science, then issues like climate change, a future pandemic, those are things that are going to put the American people's lives in danger. And we need serious leadership to address those issues.
So, Dr. Gupta, I think Zerlina really helps us set the stakes there. If this is about life and death, what would it mean if these mandates were lifted? Well,
we're seeing it play out in real time. In Ohio in 2022, what happened in Columbus, 100 children ended up unvaccinated largely, ended up getting exposed to measles. 1 in 3 ended up in the hospital. This is serious business here. This is not abstract. To Zerlina's point, also to the stakes, the CDC and the FDA, under the wrong leadership, if they appointed individuals that were enabling this, they could do some serious damage here. The CDC has the capability. We have great leadership right now. The CDC has the capability to say, you know what, we're going to move everything to optional when it comes to what childhood vaccinations are recommended, required, or optional. They could do that. The FDA could introduce delays when it comes to clearing the next booster shot. I mean, there's ways that they can manipulate the ways in which people receive vaccination guidelines. And I mean, it goes to say 35 states across the country have requirements on meningococcal meningitis vaccine. The other 15, including Arizona, the largest, which is home to the largest public university in the country, Arizona State, recommends something for which it prevents a disease that has a 15% mortality rate. Why are these things even recommended in the first place?
Yeah, well, you answered your own question. I mean, Zerlina, you had Glenn Youngkin winning the governorship of Virginia with a parents' right platform. This seems like an outgrowth of that same energy, which is, as you know, not really about parental rights. What has parental rights become a proxy for?
Well, I think parental rights are effectively this libertarian wing of the right that doesn't want government involved in any decisions. But in a moment where we have just gone through a global pandemic where millions of Americans listened to anti-science rhetoric and lost loved ones or lost their own lives because they did not pay attention to the directives of the CDC, of experts like Dr. Gupta, and get vaccinated, wear masks when we were told to do that. And I think that we need to be very serious in this moment. Donald Trump's rhetoric is not only dangerous because of the impact on our democracy, but also on our safety. And he will say, he has said himself, I don't even care about you. I just want your votes. And so we have to remember, at the end of the day, as much as the political debate is entertainment, Donald Trump is not an entertainer. He once was, but he cannot play act as president. He needs to take it seriously, and I'm certain that this will come up at the debate where we will have the contrast between somebody who is leading the country and somebody who has been involved in a performance of the role as president.
Dr. Gupta, I often talk, to Zerlina's point, about sort of the Trump hangover, the fact that even when he is not in power, there are still reminders everywhere of the effect that he had on public opinion. And these attitudes about vaccines are just one example.
Oh, absolutely. You know, what we saw pre-pandemic to now, to Zerlina's point, to build on that, there's been a 50% increase in the number of parents who think pre-pandemic to now that routine childhood vaccinations like measles, mumps, and rubella should be voluntary. Just over the course of the last few years. So the spillover effect is real. And we're seeing this depth of expertise. Dr. Fauci talked about it a few days ago, the unwillingness to buy into expertise. What does that mean? We've created an unsafe environment for people as they navigate their own healthcare journey, that they're going to rely on supplements, things that are not FDA approved because they don't believe in the FDA, whatever it may be. So now we have a bunch of individuals who are willing to take their own healthcare decisions, leveraging the internet or leveraging their favorite podcast host. And that's not where expertise is found. And that challenge of expertise here is posing multiple challenges. But again, we've seen just this over the last 5 years.
As we talk about the decline of expertise, what a treat to have an actual medical doctor with me, Dr. Vin Gupta, my friend, Zerlina Maxwell. So good to see you on my TV. Thank you so much for taking the time to be with us.